Trevor Benko here, CEO of TGB Supplements.
Ben Jordan, CEO of TGB Supplements.
Today we're going to do a video talking about BPC-157. We've been doing a lot of research into this peptide recently. I recently hurt my knee 3 to 4 weeks ago doing heavy hack squats. I tweaked it. I came up on a rep a little too hard and extended my knee a little bit too much, and it ended up tweaking my patellar tendon. So it swelled up. It didn't get bruised. So I had already been looking into it for a previous shoulder injury. So I finally decided to give it a try. And we're going to talk about my experience here after we get into a little bit more about the peptide itself. Before we go any further, I just want to tell you this is not medical advice. This is for research and informational purposes only. So do not take or use this peptide, without your doctor's permission. It's currently not for human consumption. It's for research and animal testing only. But getting into the peptide itself. Ben, you want to talk about the method of action?
Yeah, the main characteristics of healing, it's granulation tissue, angiogenesis, and the production of collagen. Collagen is what makes up our tendons and ligaments. It gives its strength and pliability for movement.
And angiogenesis is actually the production of new blood vessels from the blood vessels that are already there to increase the blood supply.
Yeah, it modulates, it's the VEGF, which is the Vaso Endothelial Growth Factor. And that is a growth factor that causes capillaries to grow into a new area to carry blood and nutrients.
And that's one of the biggest issues with tendon injuries. Normally there's not a good blood supply there, so it has a hard time healing. That's one of the main benefits of BPC-157.
Yeah, same thing goes with ulcers too, which we'll kind of touch on that a little bit later.
Yeah, ulcers, in the stomach, they actually say that oral consumption of BPC may actually heal a lot of the stomach issues like ulcerative colitis, the ulcers themselves, and even from NSAID abuse. They call it the NSAID antidote, which is very interesting because a lot of bodybuilders take a lot of NSAIDs for pain. So that's a very interesting fact.
Yeah, from that increase in blood flow and nutrients, that's how the healing happens. It only occurs in actual tendons and muscle tissue, other than an ulcer.
Yeah, I mean, the thing that really caught my eye was, that it is actually causing healing. It's not just a temporary action. It's something that's actually going to cause your body to actually start to heal whatever injury there may be there, and it can be used orally, subcutaneously, or intramuscularly.
Now with intramuscular, that one's going to be more for like muscle repair. You want to try to get it as close as you can to the tendon or ligament. Subcutaneous is preferable in that aspect.
Yeah, for my injury, I've been using subcutaneous on top of the patellar tendon, which we're going to show you how to inject into these areas. We're not actually going to use BPC, but we're going to give you an example, of how to hit some of these difficult areas, and that'll be coming up soon.
Yeah, there was a study done with 2 groups of tendon explants, which means they've taken the tendon out. One group was cultured in BPC, and the other contained a medium that lacked the BPC. The cultures were examined thereafter for tendon fibroblast outgrowths. Such outgrowths indicated tendon regeneration.
Yeah, and supposedly the BPC, I mean, it just what it can do as far as the healing is almost unbelievable. It's almost miraculous. What it's actually doing to the body. Some of the studies that have been done, I mean, it shows repair within a few days of use.
Yeah, BPC, it's shown in some rat studies, not in vivo with humans. It's healed torn quadriceps muscles, completely detached Achilles tendons. Muscles have been damaged or crushed. There's dramatic fast recovery for muscle tears, tendon to bone healing, so it actually helps reattach the tendon back to the bone.
Yeah, there's been even some human trials that demonstrate the prevention of stomach ulcers, like we were saying. And one of the biggest things is that there's no adverse side effects in any of the human clinicals or studies that have been done, any of the human trials. I mean, that's huge. When it comes to new compounds or peptides, one of the biggest concerns is whether or not there's going to be side effects or side effects down the road that we may not be aware of. But as of right now, all the studies that have been done, there have not been any side effects whatsoever. And from my personal experience, I have not noticed any negative side effects other than the fact that it seems to repair whatever injury you may have. I mean, within 3 days of using it in my knee, I was able to walk normal again. I could barely go up and down stairs. I could barely take my shoe off for a couple of days. As soon as I started using the BPC, within 3 days I was walking fine. Within a week I was back to doing legs. I missed 2 leg workouts because I do 2 leg workouts a week. I missed 2 leg workouts and I was back to training legs a week later, where I was barely able to go up and down my stairs. So I mean that just shows you. I mean, I'm definitely impressed, which is why we're doing the video. I mean, it impressed me that much that we wanted to, give you guys a thorough explanation because we didn't feel like there's a whole lot of information.
My left clavicle, it's actually separated from the collarbone, so I'm probably more predisposed to have an injury there, so I should probably keep my movements a lot tighter. Live and learn. But my shoulder is very stiff. I had a hard time like taking my arm over my shoulder to put t-shirts on. And like Trevor said, it's after 3 or 4 days, all my range of motion was back, all the inflammation and everything was down, so I'm very impressed.
Yeah, the one thing, I've been using it for about almost 3 weeks now. It hasn't totally healed, but from where it was at to where it is now, I mean, I can't say enough good things about it. So getting back into the structure of this peptide is actually made up of 15 amino acids, and it's partial chain of body protection compound, which is known as BPC. It's isolated from stomach juices or in lab animals. That's where it actually comes from. The peptide is renowned for its ability to heal and improve digestive functions, which is very interesting. This could be something that could be used for like ulcerative colitis, Crohn's, maybe some of these other diseases, and things that there's no answer for out there right now.
It might even help people utilize their nutrients better if they're eating a lot.
Very well
yeah,
could.
That's something different.
And it kind of makes sense, being that it is actually derived from gastric juices. So, it kind of makes sense when you think about it.
Yeah, I mean, anybody that wants to improve their digestive functioning, they could benefit from this peptide.
Absolutely. I mean, and the thing is, it's pretty cheap out there right now. I'm not sure of the quality from some of these companies, but usually you can find it for less than $50 to start out.
Yeah, it seems like a trend with a lot of the research peptides. If you're paying, it seems like it's too good to be true, or man, that's a hell of a deal. I'd probably stray away from it.
Yeah, I mean, that does seem to be true a lot of times. This peptide actually ameliorates digestive function by protecting the endothelium, which is grouping the cells which lines the inside surface of blood vessels. In addition, it acts on the process of angiogenesis, like we talked, which is very interesting. There's studies that also link the peptide with anti-inflammatory properties. In test subjects, usually animal, the peptide regulates and controls blood flow within digestive tracts. Over time, more information about the potency and effects of BPC will surface, but right now there's not a whole lot of information out there. So that's why we're trying to put together this video, trying to get as much information as we can. It's important to note that the peptide is only for research purposes right now, so it's not to be sold legally for human consumption. So just keep that in mind. I know we've said that more than once already, so just kind of making you guys aware. It's something that you have to kind of take at your own risk.
Yeah, I mean, based on some of the test subjects on the animals, the peptide, it will be best for humans who've experienced digestive difficulties or chronic or sporadic nature.
Yeah, of chronic or sporadic nature.
Of their digestive.
Yeah, so if you're having digestive issues, this is something that could actually help heal your stomach or your whatever issue may be going on. If you have an ulcer, it could actually help heal the ulcer. Like we were saying earlier, one of the biggest issues with ulcers is the lack of blood flow or blood supply. Now, angiogenesis can be an amazing thing for a bodybuilder, and it can also be bad for somebody that has, like, let's say, a tumor, because this is the reason why it's so beneficial to help heal injuries is also the reason why tumors will develop and grow. If there's a tumor there, it needs a blood supply to feed it, and sometimes when you have certain types of cancers, they use anti-angiogenesis drugs to prevent the blood from getting to the tumor and accelerating the growth, if that makes sense. Just a little bit more detail.
Yeah, this peptide, it promotes longer cell life, even cells that are under stress, or cells such as wound sites. So like Trevor was saying, if it would be something like a tumor or a cancer cell, it could expedite their growth as well. Traumatized cells, they respond to this treatment very well by regenerating way faster than a normal rate.
Yeah, in particular, bodybuilders may find that this peptide offers great promise in terms of ability to speed healing from certain injuries or wounds. It reduces the inflammation and can repair damaged muscle tissue. That's why, that's what caught our attention, really.
Yeah, and I was doing IM for the BPC, which we will show you later on. It would be very hard to do it at my AC joint with just one person. But we'll show you how to do that sub-Q later on. It might seem crazy, but since I've started it, my left delt seems a lot fuller than my right delt. So, I mean, that could have to do with the recuperative properties of it.
Well, once I started, my knee got back to normal where I could actually train again. Once I could train, at about 85-90% leg training, I started hitting other areas because I've had Achilles tendonitis now for a year and a half. So I actually put it into my Achilles, and it was swelled up. I even have a picture of it. The next day, the swelling was gone. It was feeling better. Now it came back. I probably need to stay on it and hit it every couple of days because BPC doesn't have a carrier, so it actually needs to be injected close to the site. That's why you want to try to get it within 1 to 2 inches of the site if you're going to do a subcutaneous injection. I did use it in the shoulder. Like I said, I do have a shoulder injury, so I did end up using it in my shoulder. And just to let you guys know, I haven't done incline barbell presses in a long time. I was able to work up to 225. I did that for 30, and I ended up hitting 315. I only did 3. I probably could have did like 6 to 8, but I didn't want to push it because that's the first time I've even had a barbell for my chest in over a year. But just to give you an idea how good I've been feeling as far as my injuries, they're healing up.
Yeah, depending on the type of injury as well. If it is like a tendon separation, and it would be something that you'd worry about the anchoring point, with the BPC healing, it's probably not going to anchor it back to where it was originally. So say it'd be like a quad completely detached. It would help it heal. It's probably not going to heal back in the normal spot though. I'd say it'd be more beneficial if it was like a partially torn tendon, or if it was ligament, because that doesn't have to do with where it's anchored at. So if it'd be something pretty serious, I would probably look into the doctor first of getting it re-anchored back at the normal spot, and then utilize the BPC to speed up the recovery.
Yeah, a friend of ours actually has a quad tear, and I think he's actually experimenting with this now. Actually,
Really?
yeah, we had him on the podcast, but I think he's actually he's going to be on episode 4 of the podcast. I believe he's actually experimenting with BPC as we speak for healing after his surgery. He got it reattached. Now he's using it to help repair. Another thing this peptide is known to actually, or believed to help in, is decreasing pain in the damaged areas. Those who suffer from discomfort from muscle spasms, or have damage, pain from a damaged muscle, may benefit from the treatment with this peptide once it's approved. So that's another use that it may actually, benefit bodybuilders. What else? It's also.
I think another study that they did, this was on laboratory mice, but they did have skin burns, and it healed at a very fast rate. It was administered in like a topical fashion, like a transdermal, which that'd be pretty cool to have to look up the molecular weight of it to see what that would do.
I want to say the molecular weight is like 1456.
Oh,
it's pretty high.
That'd be too heavy for
yeah,
normal
I'm
then.
Pretty sure, because it's like, I want to say it's like 29 amino acids. I'm not sure. Don't quote me on that.
If it is like 1400, that would be pretty high for them to put it in a topical. I want to say like the range is, the lower the molecular weight, the better it will work in a transdermal.
Yeah.
I want to say it's like around 500 or 600 is like the limit for a good transdermal product.
Yeah,
Don't
usually,
quote us on that.
Yeah, usually you want it to be
sure.
like 400 to 500 is best. But sometimes there are some exceptions there.
Yeah, but back to the burns. It healed the burns in the lab mice. The burns were deep partial skin thickness type burns, and they covered 20% of the mice's body. So that's pretty substantial what it can do there.
Yeah. Also, in addition, clinical trials demonstrate that BPC-157 has the capacity to heal certain types of damage to liver organ. The liver organ, which is huge. I mean, the liver is responsible for so much. Now, in this particular case, they're looking at people that had alcohol abuse. BPC-157 is non-toxic, and it can promote liver health without causing any unwanted side effects. So that's another interesting potential benefit from BPC.
Here's a good one. What if somebody had bad stretch marks?
I don't know.
That might help heal up stretch marks real quick.
It could. Yeah, I mean, it definitely could have a benefit there, especially with it, since it heals wounds. And,
right.
Yeah, it's definitely a possibility. It wouldn't surprise me.
If it would work well like that, that'd be something serious.
Yeah, absolutely. I mean, especially for
women, for
yeah,
sure.
especially during like a pregnancy.
That'd be
And
something to look into.
yeah, for sure. I think it could be another potential benefit.
Yeah.
Now, BPC is actually considered a pentadecapeptide. Did I say that right?
Yeah.
Pentadecapeptide.
Mm-hmm.
units.
I think penta is 5 and dec is 10, so
Yeah.
15 shape.
Exactly. Let's see, dosing.
Well, I mean, what is it, 10 kilograms per?
Well, they say 10 micrograms per kilogram.
Right.
Now, to convert pounds to kilograms, it's 2¼ pounds equals 1 kilogram. So, for example, I'm 225 pounds right now, so that would be 100 kilograms. I believe that's correct. At least it's close. Let's say if I was 100 kilograms, that would be 1,000 micrograms. Now, that, in my opinion, is a little high. From what I've seen, most people were using anywhere from 250 micrograms up to 1 milligram. Now, myself personally, I'm going anywhere from 500 micrograms to 700 micrograms per day. Now, I'm doing one injection. How are you doing it, Ben?
Yeah, I'm doing 250 micrograms in the morning and then 250 before bed.
For me, that seemed to be plenty. I mean, it definitely seemed to help as far as the healing. I noticed the benefits rather quickly.
I might try to bump it up a little bit just to see what it would do.
I did hear from a guy that took like 10 times the recommended dose accidentally. Now, I'm not sure how he did that, but sometimes it's difficult, when you're reconstituting a peptide, which in the coming up clip, we're going to show you how to reconstitute a peptide. So in the case of BPC, I used 2 milliliters of water. My BPC was 5 milligrams. So in that 2 milliliters, that's going to give you 200 units of water. Each unit, or each 10 units of that water, is going to be 250 micrograms. So I would do 20 units, which would be 500 micrograms, once per day. That's what I was doing. Now you can mix as much water in as you like. It's just going to change the dosing. So for those of you that aren't familiar, be very careful and take your time and make sure you do your research and do it the right way. Like I was saying, this guy that I'm mentioning in particular, he did about 10 times the recommended dose, which is pretty much the whole vial at one time. And the only side effects he noticed, now this is just his case, in his case, he was a little bit irritable for about 4 hours. Other than that, he said a little bit of a headache, and that was it. So from the studies that have been done, it seems to be relatively safe, and the benefits seem to be unbelievable. I've heard that some pitchers are using this. A lot of professional athletes that are injured a lot are using this. CrossFit, mixed martial arts. I mean, all these different sports, just because of the potential benefits. I mean, if you're doing a sport for a career, if you're a professional athlete, if you could be out, let's say, a week instead of 6 months, who wouldn't do it? When your career is on the line, especially if it's pretty safe. From what's being studied so far, it appears to be safe. But that's just our opinion. So take it for what it is. In my opinion, it's very beneficial. It worked very well for me. I will continue to use it if I have any other injuries. I'm not going to use it all the time. I'll probably do like a 4 weeks on, 4 weeks off type of thing at the very least until I'm healed up. But as of now, I mean, I can't be any happier, honestly. I mean, my shoulder's feeling better, my knee's feeling better, and I'm going to start working on this Achilles here next. So another thing, one of the things that some guys are doing is it's pretty synergistic with TB500. Now they work differently, and we'll go into detail about TB500 at another time. We're doing some research on it currently. I haven't used it yet myself, so I don't want to talk about it since it's not something I've personally used as of yet. But we will be using it in the future. At least I will. I don't know if you're going to try it, but
yeah,
I'm most
hopefully
certainly
mine straightens up, then I should be good to go. If not, I might throw a little TB in there.
I'm definitely going to be trying the TB because I have some more injuries yet. But they say that they have a synergistic effect. So we'll have more on TB500 coming soon. Other than that, that pretty much wraps up the BPC, right? Anything else you want to mention?
No, I think we covered everything pretty well.
Next, we're going to show you the video of how to hit these, different sites.
Yeah, and these are some of the harder sites too, so you might have to have some assistance.
Yeah.
But they would be beneficial if you could have it done that way.
Yeah. And how to reconstitute any kind of peptide.
I think we even talk about the units on the insulin syringe.
Yeah.
Which that's probably how that guy had that mistake, and he probably put in a milliliter of water and thought he had to draw out that was 1 unit.
Yeah, exactly.
Yep.
Yeah, that's what I'm figuring. That pretty much wraps this up. So keep an eye out for us on social media, Facebook, Twitter, Instagram. Give us a like if you liked the video, if you enjoyed the information. That lets us know that you appreciate it and you want us to do more. If you have any videos that you'd like us to do, put them in the comments.
Please subscribe.
Yeah, please subscribe to our channel. That helps us out a lot. We're starting to grow, it seems, and we're working on our forum. It's going to launch on April 1st. If there's anybody out there that wants to be a sponsor on our forum, please contact us. It will be free promotional opportunity until things start rolling. So you might get 30 to 60 days for free. If you have any kind of fitness related company and you're interested in being a sponsor, come and check us out. Also, if you're a YouTube celebrity and you have an interest of coming on the forum, we'd like to actually have a section for guys that have YouTube channels so you can talk to your fans live and interact with them on our forum. It will be free of cost to you, and it will actually give you another way to interact with your fans. We think what we're trying to do with the anaboliccartel.com, the forum, is we're trying to make it into a modern version of a forum. A lot more video, podcast. It's going to be based around the podcast. There's going to be a lot more information, and it's going to be more readily available. It's not going to be just reading like some of the old school forums. You could read all you want, but we're going to have videos on there. We're going to have a lot more social content to keep it more entertaining, and we're going to try to make it so you can actually know who you're talking to, because we're going to encourage the members to have their own videos and interact with us, one-on-one live. We're going to have live podcasts eventually. We're going to have celebrity guests on the show, so keep an eye out for that. So check out the Anabolic Cartel social media, TGB Supplements social media. If you need any supplements, please check us out, tgbsupplements.com. That wraps it up. We got more videos coming soon. Take care. Okay, on to the injection portion of our video. We're going to give you a little bit of an example of how to hit some of the different spots that you may use BPC-157. So we got our friend Jake here, customer. He actually hurt his bicep recently. You want to tell him a little bit about how you hurt it?
Yeah, I recently tore my bicep tendon. I was doing deadlifts. I was doing an over-underhand pull, putting a little more pressure on my bicep than two overhands. And when I got about halfway, I felt the pop, and when I got it checked, I tore the medial aspect of the tendon.
And Jake's had a couple other injuries in the past here, so he's been doing some research on his own, checking out this peptide for his own use, just for the healing part. Personally, myself, I've used it in my knee, with great success, and I've been using it in my shoulder, in my Achilles tendon as well. Now, some of these spots are kind of hard to hit with an injection. Even though it is subcutaneous, it's just a weird area, so that's why we're going to do this demonstration. Now, this video is for research and informational purposes only. It's not medical advice. Don't try this at home. We're going to show you how to reconstitute any kind of peptide. Doesn't have to be BPC, any kind of peptide. You do it the same way. Now, to do that, we're going to use HCG. We have a little tablet of HCG here. We're going to use backwater, and we're going to be putting 2 milliliters of backwater into this vial, just to kind of show you how it's done. You want to have a mixing syringe. One thing we don't have is alcohol pads. You want to grab a couple?
Yeah.
Don't want to forget the alcohol pads. Even when it's a new vial, you should always swab the top. We're going to need probably at least, 10 to 15?
Okay.
Just to be safe. Anyway, so Jake's going to be doing the bicep tendon. I'm going to be doing my knee. It's going to be, I hurt my patellar tendon, so it's going to be right on top of the knee. Ben's got an injury to his AC joint, so that's where he's going to put the injection. Now, I've been doing 500 micrograms a day pretty consistently, one shot, subcutaneous. Ben's been doing 250 units, 250 micrograms, I'm sorry, not units, micrograms, twice a day into his AC joint. Now, he's been doing it intramuscularly. Now, you can do that. A lot of guys do that when they actually hurt a muscle. They'll inject it intramuscularly to the muscle, and it'll help with healing. But it seems to be that doing it subcutaneous is easier, and as long as you're close, within 1 to 2 inches, it's usually good enough to get the effect. The reason you have to do that is because there's no carrier with BPC. It's not systemic like other peptides like TB500. Alright, so you want to swab the top of your vial. Let it sit. Swab your water. let it dry as well. Now in this case we're going to be taking 2 milliliters. We're using a 18 gauge, 1.5 inch syringe. She'll take 2 milliliters of air. And turn the valve upside down. You'll put the air into the valve to stabilize the pressure. Now the water should come right into the syringe. I always give a little extra just in case. Okay, so we got our water. Now you'll take your vial, in this case is HCG, but if you're using any kind of peptide, usually they're very sensitive, so you don't want to put the water directly onto the tablet. You'll actually put it in an angle and let it actually go into the glass first. Okay, you're going to slowly put the water into the glass.
See, this is a really big part of it, is dripping it down the side. If you blast it into the puck, the chains of amino acids of the compound are very sensitive. You could distort it and ruin the product.
Yeah, a lot of times they're very sensitive, so you have to be very cautious with that. Now, when I let go of the syringe, it's going to pull back some air because of the pressure inside the valve. That's okay. You actually want that to happen. It should go back to the 2, which is about what we took out. Just make sure all the water's out. Okay. You want to swirl that gently. Now you want to gently swirl it, and other than that, it's reconstituted at this point. Now it's best to keep most peptides in the refrigerator. They are sensitive to temperature usually as well. So like Ben's doing, you just want to gently swirl it. You don't want to shake it or mix it up too hard, because once again it's very sensitive. Okay, on to the next part of the video. We're going to show you how to do the injection. I'm going to do mine first. I'm going to be doing it into my knee. Now, since we're just doing this video for educational purposes, I'm just going to be using backwater for this injection. So we're going to be using a 29 gauge, 1/2 inch insulin syringe. I'm going to take 20 units of water. As you can see, there's 20 units there. Be real careful recapping the needles. A lot of times that's when you end up sticking yourself. I always put it back in the wrap until I'm ready to do the injection. Okay. Now I need a swab for the injection site. Yeah. Ben's going to take the camera here. see on there, Ben, if you need to. Alright. I had the injury was to the top of the patellar tendon right here. So I've been putting it about right there. I've actually put a couple right on top. Ended up hitting a little vessel for one injection, so I kind of moved off to the side a little bit. You want to make sure you swab the site very well. Let the alcohol dry. Clear any air out of the syringe. Now you want to pinch the skin, and you're going to go in at a 45-degree angle. You want to go nice and slow. It's kind of a sensitive area. That's it. Recap your needle. Put it in your pile for garbage. Alright, I usually, if it's bleeding, I use an alcohol swab, but in this case it's not, so it should be okay. Just want to be cautious with that. Alright, now we're going to get the next one ready. Now Jake's is going to be a little more difficult because of the area that it's in. Alright, so we're going to get the water. You want to swab your vial there, Jake? A vial of water there? Okay. Ooh, I'll get you another. There you go. Ben, you could probably get yours ready as well. Okay. Now we got another fresh syringe. Same thing, 29 gauge, 1/2 inch. Let the alcohol dry. Now Jake's just going to be doing 10 units. Okay, now we gotta swab your injection site. So we have 10 units there.
More toward the inside?
Yeah, be more right in here. Now we're just going into the skin here. You want to hold the camera there, Ben? Let's see here. Alright, so we're going to pinch the skin, and we're actually going to go into the skin here. Make sure that this is wiped. Okay. clear any air. There we go. All right, same thing. All right. Good. That's it. Pretty painless. I mean, if you get the right spot, subcutaneous. It's a weird area. Just gotta take your time, be very cautious, especially if you're using any kind of research peptides. If you're not sure, you know, what may be in the bowel, that's always the most dangerous thing. In this case, with it just being water, it's not as much risk, but you still got to be sterile and clean. Now Ben's going to be doing his injection. You want to hold this actually, Jay? Yep. He's going to be doing an injection into his shoulder. I'm just going to hold the skin so he can get it subcutaneous. Where are you going to be putting it, up here? Yeah, I'd probably.
That's AC right there.
Yeah. Probably get right in there.
Alright.
Like that.
I can't really see.
You can't see.
Hmm?
Let me do it.
I meant like looking at my periphery. I just don't want to stick your hand.
You're pretty close there. Come down right there. Yep. That's it. The shoulder's not as bad. It's just hard if you're doing it by yourself. You almost have to have somebody to pinch the skin for you.
Yeah, I was doing I am, but it's better if you can do it over the top of the injury. I was trying to get it as close as I could, right at the top of the shoulder. Probably about 3 or 4 inches away. Not preferable, but I have been noticing some benefits. I'm going to try to do it sub-Q from now on.
Yeah, I think the subcutaneous is just, it's easier, it's more painless, and there's less chance of infection. If you do have something that's, you know, maybe not as clean, or you're not sure what kind of quality the peptides are, you're much better off having it subcutaneously than intramuscularly, because I mean, if you get an infection intramuscularly, it's a lot more dangerous. It could be a lot more painful. That pretty much wraps up the injection part of the video. Thanks, Jake, for coming on.
So thank
I know it's a weird spot. It's a weird spot to hit. But hope that helps you guys out. Just remember, this is not medical advice, just for research and informational purposes. All right, that wraps it up.